Hey, Mr. John, I'm your nurse, Sam. Come to do a blood draw out of your central catheter there. All right, let's get this thing going. Got a little hand hygiene here. How you doing? First thing I'm gonna do is I'm gonna check the MAR real quick, make sure I got that order in there to do the blood draw, okay? All right, can you tell me your name and date of birth? Perfect, awesome. All right, yeah, it's right there, perfect. So let's get this thing started, what do you say? So, grab some gloves. You got any allergies? Okay, just wondering. All right, get these gloves. High quality gloves right here. Used to wear these in the dish pit. All right. So let's go ahead and take a look at your central line. Okay. All right, look at that. Everything's looking great. Yeah. Everything's looking good. All the hubs are looking great. All right. So now, let me get my supplies together real quick. Come over here and knock this out. Supplies. All right, next, let's go ahead and raise you up to a good working height for me. Nice and slow, running low on battery here. All right, now I got good access. Things looking good. We're going to use this hub right here. So for this blood draw, I don't need to apparently flush at all. I'm just gonna go ahead and start pulling my waste immediately. Just prepping some alcohol pads here. All right. Got the alcohol, got my syringes. All right, let's get this thing going. I'm gonna go ahead, like that. Take off the hub, place it here, that way it doesn't roll underneath your skin. Take an alcohol wipe. Scrub the hub vigorously for 10 to 15 seconds. Okay, I'll go ahead, place my first syringe on. Nice. So I've got my waste. Go ahead and throw that in the biohazard. Sharps is good enough for me. Now this is what I'm going to be actually using. This is my good viable blood. Perfect. All right, now place that right there. I'll get that later. Scrub the hub vigorously, 10 to 15 seconds. Now we did that. We'll go ahead and flush. Flushed. Trash. What do you say we scrub the hub again? Scrubbing 10 to 15 seconds vigorously. Place the cap back on. And now you're good. Everything's good. Get you there. All right. Now what I'm going to do, in this case, the best thing to do is I have my sample here. And I have my blunt tip needle, safety first. I'm gonna go ahead and insert my blunt tip to my tube, put it all in there. It would normally be under vacuum, so I wouldn't have to try so hard. And then I will pull it out. Oh my God, it's gonna go everywhere. Because we lost our vacuum. I'll put that in the sharps. Go ahead and so sorry, Mr. John. That normally doesn't happen. It just went everywhere because it's not under vacuum. Go ahead and put my label on here. Everything's good here. Yeah. Get ready to ship that out. So once that's prepared, I've secured everything here. I'll go ahead and move this out of the way. Take these gloves off. Throw them in the trash. Go ahead and do hand hygiene. Make sure you're good. Everything's good, clamped back, nice. Trash removed, thrown away in the trash. Put this back up for you. Put you back in the lowest position I can with your call light within reach. All right, Mr. John, you need anything else from me? Perfect, I'll be right back and we're gonna give you some meds. Okay, Mr. John, let's go ahead and give you your medications. I'm gonna confirm your medications on the MAR. And do you have allergies?
No.
Perfect, no allergies. Everything's confirmed. I'm gonna confirm the 5 rights of your medication. I have it here, it's morphine, we're giving it for pain, blase, blase, blase. All the 5 rights have been confirmed, perfect. So first, let's go ahead and get some gloves on. Take a look at your site. Bed's at a good working height for me already. Site looks amazing. See no signs of infiltration, so ka-chow, ka-chow. I'm gonna use this hub for your medication administration. Everything looks good there. So first thing I'm gonna do is come over here with all my alcohol wipes and bring my supplies here so I'm not walking 100 steps and making a 20-minute long video. Okay, so we'll take this, remove the cap, scrub the hub for 10 to 15 seconds vigorously. I can discard this. Go in here, pinch my finger, aspirate. Oh, I see blood return, amazing, flush. Okay, why don't we do our all favorite thing, which is scrub the hub vigorously for 10 to 15 seconds. Give this medication, however it's prescribed in the MAR. If it's slow push, 1 minute, great. How you doing? Everything's good? Perfect, awesome. Gave the medicine. How about this? You want to scrub the hub again? Because I do. Let's scrub that hub again. 10 to 15 seconds vigorously. Then we'll flush. And you know what? I don't think that was enough. Let's flush again. But first, let's scrub the hub 10 to 15 seconds vigorously. Flush. Perfect. You still doing okay? I'm gonna scrub your hub one more time, 10 to 15 seconds vigorously. Then we'll get you a new cap. Cool. How are you doing? Fantastic. That's what I like to hear. I'll go ahead and remove my gloves. Hand hygiene. Document that I put the medications in. And I'll return in 15 minutes to check your pain status. All right? Cool. Everything good? We got everything locked, cleaned. Everything looks fantastic. I'll go ahead and cover you back up. Here's your call light if you need anything, okay? Bed's in the lowest position. And I'll be back in just a second. I think you just got an order for a dressing change. All right, I got that order in right here on the MAR. You need a dressing change. How about that? So let's get you good working height to me. Let's go ahead and take a quick peek at everything. Looking good, looking good. All right, so let me go ahead and just open this kit up. Oh, look at that. There is a mask for you and I. Grab these gloves, put them on my hands. Okay. All right. Then I'll take this mask. I'll put this on me. And then I'll put one on my patient as well. Oh, gloves and masks, glasses. We're just so prepared today. Here's your mask. Well, that's good enough. That's the face. Yep. Okay. Now let's go ahead and remove this dressing. Everything's looking good. Nothing appears to be bleeding. So we'll go ahead and remove this. Oh, I notice your Pillow's a little damp. You've been drooling. Oh, see, now that's a problem. Look at that. The central catheter just came out of your chest. That's not what we want. We'll just put that in there and pretend that didn't happen. Perfect, got everything off of you. Now that I've removed it, I'm gonna go ahead and take these gloves off with that dirty dressing, throw those away, wash my hands, and move to my kit. All of this, I don't need. Coming in here. Oh, thank you for getting a close-up on that. Appreciate it. This. Normally we would have the right size for your hand, but this kit just comes with whatever. It's kind of one of those get what you get. All right, get on there. Okay. Fantastic. Now that I have those, I'll prepare everything in my sterile field. Look at that. Okay, there's that. Perfect. Time to clean. Here we go. We're gonna crack and wipe, and wipe, and wipe, and wipe. We're wiping away from the catheter. Perfect. Trash it. Okay. Now, usually you have an impregnated gauze that you're going to put on there, but we're just simulating. And it doesn't really work with our dressing, so I'll just leave it out for now. But I will verbalize it. So now that I've cleaned, the chlorhexidine is nice and dry now. I would put that impregnating dressing on. Impregnated, not impregnating, sorry. Then we're gonna put this bio patch on, stabilize it, perfect. Now we're gonna go ahead and place this to secure the dressing. Look at that, skills. How you doing? Fantastic. And now, per hospital policy, we're gonna date and initial this. That way the next person knows when to change the dressing. Good to go. This stuff can go in the trash. Everything looks great. Heat reacted well. I'm gonna go ahead and cover you up. I would go ahead and document in the MAR, everything was great, everything was done, what time, everything like that. Hand hygiene. And then I'll go ahead and drop you down. Bed lowest position, call lights within reach. You don't need this mask anymore, and neither do I. See you later, Mr. John.